Thank you all for sticking through before the break. I'm going to talk to you about patient level barriers that have been identified and discuss a toolkit that has been developed, hopefully to address some of those. So for any of you who don't know me, I am Joyce Reineke, and I'm the Executive Director of the Alliance for Fertility Preservation. And we are a nonprofit organization that was founded in order to provide better information and resources. And increasingly, we've been focused on working on access to fertility preservation services. I am also a cancer survivor, which is how I got involved in this work in the first place. And I also went through fertility preservation treatments, embryo freezing, which was all that was available at the time many years ago, and surrogacy to have my daughters. I'm going to be talking to you all specifically today about a collaboration that went on between UCSD researchers, researchers at Northwestern University, and researchers at Cornell in New York. So this project focused on patient level barriers and barriers at every level. But today I'm going to tell you about some of the identified patient level barriers that you've heard about from patients, and many of you are familiar with. So for the project, the focus was on 3 states that are identified here: California, Illinois, and New York. And all of those states had passed fertility preservation mandates in the last several years. So for this project, there were interviews done with 48 different providers and clinicians, administrators on both the oncology side and at fertility clinics. There were interviews done with 5 insurers and 1 insurance regulator, 5 fertility pharmaceutical representatives, 13 patients were interviewed, and 2 patient advocates. So the interviews really explored the implementation part of the mandates in each state to try to identify specific barriers to access to care and facilitators to that access. There was also a document analysis that was undertaken. And so 17 publicly available documents relating to the benefit mandates were reviewed. Those included legislative reports and also regulator guidance to give some clarity on the implementation process. Based on the analysis of the interviews and the document data, a toolkit was created to help try to increase access to fertility preservation services. So the toolkit outlined actions and also has resources to help patients through that process. So the main patient level barrier that was identified through this research was really knowledge about insurance, health insurance. And so that included patient information about health insurance generally, broadly, and just how insurance works and which plans would be subject. You saw Irene put this up earlier about which plans could be reached through benefit mandates. And there was also a lack of knowledge about patients' own specific health plans. And there was also a concern raised about patients' knowledge around how to even go about getting answers to their questions about health insurance to help them understand it better. Patients often didn't even know about the existence of fertility preservation benefits, and they didn't know that their states had actually passed benefit mandates. And as you heard from Rachel, and I think also Rhonda touched upon, just the difficulty of dealing with health insurance coverage in the midst of the cancer diagnosis. Patients found it very time-consuming and confusing to call their insurers directly and go through member services. And they were frustrated because often they got different answers, inconsistent answers from the insurers about their coverage. As part of the toolkit, in order to address some of these barriers, a series of informational videos was produced to educate patients about health insurance itself. So that had to do with kind of Health Insurance 101, benefit verification and what it is, finding in-network doctors and clinics, and information about how to appeal denials of coverage. There were also materials that were created to guide patients through the process of understanding whether their own policy was subject to the state mandates and how to file appeals. So there's an instructional guide within the toolkit to determine if the plan is subject to the benefit mandate. And there's also a benefit verification phone script, a very specific, way for patients to get onto the phone and call and go through specific questions to get answers. And there's also a template appeals letter that patients can use if they get a denial of coverage. So of course, one of the major barriers was the out-of-pocket cost. We've heard about that today. And this was especially true and salient for those who had no insurance coverage whatsoever. And because of the high costs, we have included in the toolkit a guide to financial assistance grants and programs, details on what those grants cover, what the eligibility requirements are, and even links, direct links to the applications to help the patients. So I think in terms of recommendations or next steps on the toolkit, we would love to hear any kind of substantive additions that you might have and get feedback on the materials that are within the toolkit. And we'd also love to see research about how the use of the toolkit and the specific pieces within the toolkit help patients both in their ability to navigate the insurance coverage process, and ultimately whether the toolkit and the resources therein help impact use of services. So I just want to give a shout out to the California Breast Cancer Research Program, which has allowed us to be here today and discuss all of this. And then for the research study, there was funding provided by the National Cancer Institute and UC San Diego Cancer Center pilot grant and UC San Diego Academic Senate Award. So thanks so much.